Welcome back to our discussion on the flagellates. Next we have Chylomastix mesnili. This is one of our two non-pathogenic intestinal flagellates. So starting with the troph. It is pear-shaped. It does contain a cytostome just like our ciliate does, but you usually can't see it. You could see it pretty well in Bacillium coli. You can't see it as well for this one. It has a nucleus with a central karyosome, 4 flagella, although we usually can't see those either. There's also structures in here referred to as a spiral groove and shepherd's crook fibrils. So this is the troph. This is a good picture because you can actually faintly see the flagella. There's a couple lines coming up off here, and there's a faint line here. But otherwise, it's not really remarkable. It does have a large karyosome, one nucleus, but if you didn't see the flagella, you might even mistake it for one of the amoebas. And here it is again. This karyosome is not as big, but you would want to go by size. And then the patients with Chylomastix mesnili should not be symptomatic and wouldn't require any treatment. The cyst, however, does look a little bit more remarkable, meaning we can pick it out in the stool. It is described as being lemon-shaped because it has what's referred to as an anterior nipple, or also called a hyaline knob, on one end. And it has one nucleus in the cyst. So this is a really good picture showing the cyst of Chylomastix. See how it has this little bump here where it's got a lemon shape, one nucleus, and you can see all the fibrils inside of it. And by shepherd's crook, they mean this hook shape that some of the fibrils take on. So these are all cysts. It's just this is the best picture perfect one to show you. And here's another good one. Here's the hyaline knob, one nucleus, and faintly I can see a shepherd's crook shape in here. The second intestinal non-pathogenic flagellate is Trichomonas hominis. Now make sure you keep separate Trichomonas hominis and Trichomonas vaginalis, which is the next parasite. This one is non-pathogenic again, and it's intestinal. So we will recover this one in the stool. Whereas Trichomonas vaginalis, we will recover it in urogenital specimens. So we will only be describing a troph for both trichomonases because neither of them has a cyst stage. So there's only the troph for Trichomonas hominis and Trichomonas vaginalis, which means the troph, by default, is the infective and the diagnostic stage. It, of course, has flagella. It has those axostyles again. It has one nucleus with a small karyosome. But the most noteworthy structure is called this undulating membrane that extends the entire length of the organism. And this looks like a fin, like a fish's fin that helps it with motility. And it does actually lead into a flagella. But when it's going the length of the body like this, up and down, this is called an undulating membrane. So you can see where it's going the entire length of the organism. And this is a real life picture, a beautiful real life picture. Now we need to differentiate this one from Trichomonas vaginalis because Trichomonas vaginalis also has an undulating membrane, but its membrane only extends half the length of the organism. So Trichomonas hominis is the full length of the organism for the undulating membrane. Also, this is a stool sample, and we know we won't see Trichomonas vaginalis in a stool sample. So the diagnostic stage here is troph in stool. And here's another picture. I cannot see the undulating membrane, but I do see where there's a structure in here leading out into a flagella a little bit. One nucleus, troph. Which brings us to our one urogenital flagellate we will discuss, Trichomonas vaginalis, and this is considered pathogenic. It is one of the most common non-viral STDs, with about 2 to 3 million people affected each year. Like I mentioned before, there is no cyst stage, so we are only learning what the troph looks like. So of course, the troph is infected by sexual contact. For the females, the troph inhabits the vaginal mucosa. So symptoms for females include itching, maybe even burning, frothy vaginal discharge, painful urination is dysuria. That discharge might be tinged like a greenish yellow. So females are almost always symptomatic, although they don't have to be. They are usually the ones who are symptomatic if they have Trichomonas vaginalis. Men, on the other hand, can harbor it, but they're more likely to be asymptomatic, which means it's the men who are usually have it, they don't know it, and they're passing it to their sexual partners. Although if they are symptomatic, it looks like like they have milky discharge, urethral discharge, and they might even have painful urination as well. But they mainly serve as the carrier. So the type of sample we usually see this in is urine. And it's usually the urinalysis department that's getting to see the motile trophs just by just from doing the urinalysis. So it's usually not the parasitology lab that's diagnosing this. And like I said, this can be in male or female samples. Now, we could also be looking at a wet prep from a vaginal or prostatic discharge from men. Culture is not routinely done, but that would be the most sensitive and definitive diagnosis. The culture takes a long time, so that would take a week to be able to definitively diagnose. And luckily, this is another one where commercial serology kits are available to detect the antigens, so we can get a diagnosis right away. And it is easily treated, and they recommend treating all sexual partners when found. I do want to mention it is associated with passing from mom to baby during vaginal birth. It's also associated with cervical cancer, pelvic inflammatory disease, and an increased risk for HIV. Although that associated doesn't mean it causes those things. It's just there's lots of correlations between having Trichomonas vaginalis and developing those other things. And it often occurs with other STDs like gonorrhea. Um, it dries out rapidly in the environment, but it can be passed without sexual contact, like damp, wet towels or, I don't know, moist, wet toilet seats have been implicated, although that's pretty rare. But sharing clothing or sharing any contaminated stuff like that, it does dry out rapidly, but that doesn't mean it can't still be transmitted even by non-sexual contact. So what does it look like? I mentioned before, we want to note the undulating membrane that extends half the length of this organism. Its motility is described as jerky, and it's pear-shaped with one nucleus. So here's a very pretty stained picture of two of them. So here's your undulating membrane, and you can see it stops right here. It's not going the full length. And here you can beautifully see the other flagella and the axostyle running down the middle and the big nucleus. If the urine sits for a while before you look at it, you're likely to miss trichomonas. So they stop being motile very quickly in male or female urine. So if you don't get to see the motility, you might count them as white blood cells when you're doing your counts on urine sediment. So it's important to always test the urine right away in case you might come across a mobile Trichomonas vaginalis.